Setting: local clinic. You're seeing a 46-year-old patient who had surgery for appendicitis a week ago. Inactivity and past medical history has put him at the risk of blood clots, so he or she needs heparin injections. These were started in hospitals and have been self-administered since the patient was discharged 4 days ago. He or she is concerned about bruising at the injection site. We have just examined the patient. Now let's see the task. First one says, find out more details about bruising. Onset, changes in pain. Explore any of the symptoms such as fever, shortness of breath, or nausea. Second one says, explain patient's compliance with heparin injection. Advise method, consistent time of the day, variation in injection site. Third one says, remind patient of need for injection site variation, reduce risk of trauma to skin, bruising, pain, etc. Give further advice to prevent bruising, applying pressure if any bleeding, avoiding rubbing, injection site, etc. Fourth one says, stress the importance of continuing injections, insufficient activity level, ongoing risk of blood clots. Reassure patient about injection, short term, 30 days only, bruising is common. Fifth one says, advise no need of treatment for bruising, self-resolving, no cause for concerns, etc. The last one says, recommend next steps, continuation of injection, doctor's appointment. Now let's begin the role play. Thank you, James, for your kind cooperation to examine your condition. Based on the examination, I could see some bruising on the injection site. A bit done, we are well concerned, and this can be easily manageable, and we are here to help you. Before proceeding further, I would like to ask you some questions regarding the condition. May I proceed?
Please go ahead, nurse.
When did you start noticing the bruising?
Nurse, the bruising appeared almost a couple of days ago. I mean, after I started taking the injections.
Okay, James, can you please tell me if you have any pain in the site of injection, or did you see any changes in the pain?
Yes, nurse, the bruises are more painful now than when they first appeared.
I'm sorry to hear that. You're in pain. Do you have any other symptoms such as fever, shortness of breath, or nausea?
No, nurse. Fortunately, I do not have any other symptoms. I'm okay.
Okay, James. Good to hear that. And may I know the details of your compliance with administration of heparin injection?
Nurse, I've been taking the injection on a regular basis as advised by the doctor.
Okay, James. How were you taking the injection? I mean, on the same day consistently? May know if you were changing the injection sites?
Nurse, I was taking the injection regularly at the same time of the day, but unfortunately, I forgot to change the injection site. I was taking it on the same area of the skin.
Thank you, James, for sharing those details. As you told me that you were administering the injection on the same site regularly. So, this is the primary reason for bruising, but don't panic. I can provide you with some suggestions regarding the administration of heparin injection so that such conditions and further complications can be avoided. May I proceed with that?
Sure, nurse. Please proceed.
First of all, it is important to change the site of injection to reduce the risk of trauma to the skin, pain, and bruising. Let me explain to you in detail. First of all, you need to be consistent with the time of injection. Along with that, it is not really advisable to take injection regularly at the same site itself. Instead of that, please change the site of injection every day to avoid the unnecessary complications. Therefore, I would highly recommend you to change the site of injection as it can reduce the risk of trauma to the skin, bruising, and pain, as I mentioned before. I hope you're following me.
Yes, nurse. I understand that. Now,
To suggest you some more measures to prevent further bruising. That is, if you see any bleeding, please apply pressure to the injection site, and it is also important to avoid rubbing the site after the injection. Okay, James, I hope you're with me.
I completely understand that, nurse. However, I think it's better if we can stop having the heparin injection because currently I'm able to move around my house without much difficulties. So I do not think I need the injection again.
I completely understand your worries, James. However, it is very important to continue injections as your activity level is not sufficient, and moreover, there are ongoing risk of blood clots. Therefore, it is highly recommended to continue the injection as per the doctor's advice to prevent all these complications. Okay, James, I hope you understand the seriousness.
Yes, nurse, I do. But I'm really worried about the bruising. What can be done to manage it? Do you want me to go for any treatment? Moreover, how long should I continue the injection?
I can sense your feelings, John. Please set your mind at ease. This bruising is quite common, and injection needs to be taken regularly for a period of 30 days as advised by the doctor. There are no treatment required for bruising as it is all self-resolving condition and nothing to be concerned at all. I would appreciate it if you continue the injection until the next appointment with the doctor. Do you have any more questions for me?
No, nurse. I will continue taking the injection until the next appointment with the doctor.
Glad to hear that, John. Before we wrap up, I would like to recap what we have discussed until now. So far, we have been discussing about the bruising, followed by the heparin injection, its post-pill causes, and some remedial measures. I hope you understand that. If you have any more questions or concerns, you can contact me at any time. I'll be glad to help you. Thank you, John, for understanding the situation and accepting my suggestions. I wish you a faster recovery.
Thank you, nurse. Thank you very much for your support. Thank you.
Thank you all. Our role play and see you.